Seeing a virus move from a very small outbreak in a very limited area in China, so across the entire ocean, to becoming endemic basically throughout the entire world is not in any of the public health books. I have a master's degree in public health, so that's not what we talked about. Nothing prepared myself or my staff for standing up a response for over 2 years.
7 years ago, Katherine Wells moved to Lubbock and applied to become the director of public health. She soon learned the city's health department was significantly undersized.
We were only able to provide some very basic services. So my initial projects were really developing and creating capacity within the health department.
10 employees became 50, which became 80. And thank goodness for her expansion efforts, because soon the city of Lubbock, like the rest of the world, would be hit by a deadly virus no one knew much about.
There's nothing that said a health department has to set up a vaccine clinic or a testing site, and those choices were made by myself and my staff here. I'm really wanting to do the right thing for the community. We've given 175,000 shots in the last year and a half. We had over 70 clinic days. Over the summer we did all those pop-up clinics, and then we opened up that hub clinics, the mini hub. I couldn't tell you how many phone calls. I mean, thousands, hundreds of thousands of calls, because it's not just the people we were vaccinating, it's the people that have a loved one that had COVID. And yes, there were some mistakes at the beginning. We crashed the city phone line because so many people called for appointments. So the next day we changed how we make appointments.
Katherine Wells took on a role she never could have expected.
There was no choice. It was, either stand up or step aside, and really standing up and trying to take care of the community and doing the right thing, and to be recognized for that, it's really, it really means a lot to me.
She never imagined being at the forefront of the city for 2 years and counting.
Never imagined doing, I think we did 65 press conferences with the mayor and myself. Never expected to be on the news every day. Being recognized in the grocery store for my work. Public health's usually something you do behind the scenes.
The pandemic has been tough on most people, but especially Katherine.
Trying to keep yourself going and your family going, but then also feeling like you need to help the entire community. We had one nursing home here that we lost 70 patients over the course of probably 2 months. We knew those people's names. We were following them through their illness, and that was a huge traumatic experience for staff.
She's felt the loss that so many others have felt throughout the pandemic.
I lost a friend's father who, my family's been very close with, died of COVID. And then there's that collective loss of the community. Over 1,000 individuals in Lubbock died.
Tasked with overseeing public health in a city of nearly 300,000 people.
We're also that hub where other counties, lots of people come to seek health care. We have patients that come into our hospitals from New Mexico, even from Oklahoma sometimes.
Because of Katherine, Lubbock had the resources people around the world needed to survive the pandemic.
When we opened up our hub, we had people drive in from Colorado, New Mexico. I know we've had individuals come from other countries. They'd fly in, people from the Dallas area, the Houston area, that would come up here because we had such a system to provide vaccines. They couldn't get vaccine at home.
She continues to sacrifice an extraordinary amount.
I haven't been able to take a real vacation and unplug. Everywhere I go, people ask about COVID. I have a 9-year-old daughter, and she's just like, Mommy, I hate COVID. I want it to go away. And I'm like, so does everybody else. But she really feels the brunt of it, because when I come home, that's what you talk about. When you turn on the news, that's what's on the news. Learned a lot of good mental health lessons, a lot of good how to care for myself. I have great friends in the community that have all stepped forward and helped me, whether or not that's picking up my child or giving me a hug or listening to me, cry on the phone for a little bit.
Not only did she rise to the occasion, but she went above and beyond for others.
I feel like I can do anything now. Definitely believe that I could tackle a lot more than I ever thought I could. Feel like I'm much more educated, feel like I can help other departments and other agencies. I've become a true advocate in public health.
And as her department begins to refocus on other health issues facing the Lubbock community, she plans to use her successes here to improve public health nationwide.
My hope is to be able to provide that expertise and be kind of one of the top smaller health departments in the country so that my staff can go out and help other communities, or other communities are welcome to come here and learn what we're doing in Lubbock. I think it's a great model, and it has the potential to be replicated in other areas.
For Next Star's Remarkable Women, I present to you Katherine Wells, and with KLBK News, I'm Elizabeth Fitz.